It's nearly, thank you. Yeah, it's nearly Sunday for me. I'm in the UK and it's just a few minutes after 11 p.m. It's okay. So whereby maybe you're still seeing sun, I'm seeing darkness. Okay. So I'd just like to welcome everyone here. Okay. There are 30 of us on the call, and I know it must have taken some effort of you to be here with us. Today is a very, very special day for us. We have three dynamic speakers, okay, and I've been given the role of, being the moderator. But I want today's webinar to be about you. Yes, the three speakers will have their say, but there will also be an opportunity for you to ask questions and for you to join in the discussion later. So before I move any further, I'd just like to let you know that we are recording the session. And it's just that many people have asked, they did send me emails and messages and ask, if we could record it so that they can listen to it later. So just please bear that in mind. This is an open forum. Okay, my name is Solomon Alexis. I am Saint Lucian. I'm from Rosalie. I work in the UK. I've been in the UK for a few years, or many years now. Okay, I started my life in Saint Lucia as I went to school in Saint Lucia, Rosalie Primary, Rosalie Infant, Rosalie Primary. Then I went to St. Mary's College. Okay, I started teaching. I taught at many different schools, but most of them at the Rosalie Primary School. And then I came up to the UK to study, and one thing led to the other, and I'm here. Okay. I am also, yeah. Yes, Solomon. Yes, Bibiana. This is Solomon. Okay. Yeah, I'm also a cancer survivor. And I remember my first meeting here, I asked, what time do you become a cancer survivor? And I am a cancer survivor. I was diagnosed with multiple myeloma in August 2018. Okay, and since then I have been on treatment. I am on active chemotherapy treatment. I had my last dose of chemotherapy treatment 2 hours ago. Okay, so this is my life. I will be on treatment for as long as I am alive. Okay, I've had a stem cell transplant. I feel good within myself. And I'm sure a lot of what we'll hear this evening will resonate with you. Okay, and if you are a cancer survivor yourselves, you will be able to share in some of the experiences that we have. Okay, so I want, as I said, I want today, the session today to be a very lively one. Okay, just to ensure that we give everybody a fair hearing. What we will do is that each of the speakers, I'll give them about, in the beginning, I'll give them a few minutes just to introduce themselves. Okay, and then they will move into the bit of things, because what we are doing today, as you have seen in the flyer, is that we're going through the entire journey. Okay, and when I say the journey, we're going to start from the very beginning. When you first heard that word cancer, to treatment. Okay, and then we'll move. So we'll look at the entire journey, and so this is where we are. But before we actually start the webinar today, I'd like to call on Dr. Francisca Plummer, okay, to tell us a little bit about Pillars of Hope, okay, and the cancer support group of the Saint Lucia Cancer Society.
Thank you, Solomon. And it's Miss Plummer.
Oh, Miss Plummer.
It's Miss Plummer, and I'm quickly going to go through. Good evening, everyone. I'm going to quickly go through a brief just summary of what the group is about, to really run you through, give you an idea, especially if you may be someone who is interested in knowing more about the group. So Pillars of Hope is the cancer support group of the Saint Lucia Cancer Society. The group was only recently launched in March of 2021. So we've had just a few meetings. We do meet once a month on the second Saturday of each month. So that's quite regular. Hang on, I'm not moving. Okay, here we go.
Yes,
The key objective of the Pillars of Hope is to facilitate support for members. All our members are cancer survivors who we adopt a definition of that to be anyone from the moment of diagnosis with any type of cancer. So our group is open to any person with any type of cancer. As you can see here, our tree represents many different types, many colors, depicting many different types of cancers. So we are open to anyone with any diagnosis of cancer, anyone who has a personal experience of it. We offer a safe space. The group meets once per month, about an hour or so. We want to offer a place where people can share, where people can talk. It does offer a sense of belonging, I guess, because you are in a group of people who understand your experience. Many of them have been along the journey, although not necessarily always the same exact path, but they understand a lot of what it's like to be on that journey. It's a place to share, to offer a sense of community. And this picture here depicts one of our activities that we had in June, which was a mindful walk we did on Cancer Survivors Day, which was the 6th of June, 2021. So the group offers not only a place to speak. Some people are not hearing. Are you hearing me okay?
Yes, I am.
Okay.
I am. I think
Okay.
people need to check the speaker.
Okay. Just checking. So Pillars of Hope really offers that sense of community even outside of meetings as well. The group is open, as I said, to anyone with any type of cancer from the moment of diagnosis. If you are on the call and you are interested in joining the group, please, I will put the details up in the chat a bit later, but you can email us, and also you can call up the Saint Lucia Cancer Society at any point to express your interest. They will get your details and we will be in touch. To make the group successful, obviously, a lot of attention is placed on confidentiality. We want to make it a safe space, so we want very much that all members who participate respect each other. They respect each other's right to participate. They are courteous to each other, and they take responsibility for the success of the group. So we do emphasize the importance of offering a safe space and each person's responsibility to make the group a success. Meetings generally have this kind of format. We would have introductions, so every person on the call would introduce themselves. We will go through the group agreement, and oftentimes we will feature a speaker from within the group itself. Occasionally, we do have a guest speaker. And in June, because it was Cancer Survivor Month, we did feature Dr. Delia Samuel, who addressed our group, and who is, of course, a cancer survivor herself. Occasionally, we would have guest speakers as well. And there is a lively discussion in which people share, they exchange experience, talk about what works, what has helped them, etc. All in, of course, the aim of sharing experience and hoping that it would help a member on the call. As I mentioned a few times before, June is Cancer Survivors Month. This is the context in which we are actually doing this webinar as well. We had 4 activities planned for June. We have successfully executed all of them. We are on the 4th item today. We had a mindful walk. You saw a picture earlier. We had our monthly meeting, and we also had, in this photo here, you see our sip and paint activity. So that was recently held last Saturday, in which survivors came together, survivors and supporters. They came together to share, to paint, and to have an experience of being together, sharing, etc. So the group is really not just about meeting online, but also trying to connect and offer that sense of community for everyone. If you are interested in becoming a member of Pillars of Hope, you can email us here. You can call up to us, and somebody will be in touch with you to follow up on your interest in becoming part of the group. So this was my brief introduction to the group. We look forward to your participation. Please call, please email, let us know of your interest, or if you want to contribute to the group in any other way as well. Thank you so much.
Okay, thank you very much, Ms. Plummer. Thank you very much. We do appreciate that. And friends, okay, I hope you take this opportunity to see what it is that we have to offer. As Francisca said, it's an opportunity for us to share, for us to support each other in whichever way that we can, and just sometimes just to listen to each other. No one is forced to say anything, okay? But sometimes when you hear it from another person, it gives you a little bit of courage. And I'm extremely proud to be, a member of Pillars of Hope, and I have attended, I think I've attended 2 meetings so far from the time I was invited, although it's late for me, but I still make the effort. So I'm inviting, many more people, okay, those of you on the call, and if you know anybody else, invite them to join the Saint Lucia Cancer Society, and so that we can be that support mechanism, that scaffolding for each other. Okay, so moving on with today's, what we want to do today, I will ask each of the speakers to briefly introduce themselves in about 1 minute each. So the speakers will briefly introduce themselves, and then we will go through their journey. They'll tell us about their journey. After each of the speakers will then speak. Okay, we'll ask them to speak for about 10 to 15 minutes. Right. After that, if there's any short comments that from questions in the chat, we'll ask you. We'll fill these questions. Then we'll move to the second speaker. We'll do the same thing. Okay. The third speaker will do the same thing. Okay. And then then we'll have about 20 minutes where we'll have a general discussion, and you can ask any of the speakers any question that you wish. We'll have a vote of thanks. Okay, and a closing. So we have for maybe an hour, 15 minutes should be able to take us through with that. I would just like to ask, I realize I can see there that everyone has kindly muted their microphone. It makes it easier for us to hear everyone. And of course, when you need to speak, you can turn on your camera if you want. You don't have to. Okay, of course, unmute yourself and we can take the discussion forward. So the first thing I'd like to do, so now I'd like to call on Miss Jennifer Joseph, just to briefly introduce yourself to the group. Jennifer.
Hi, good evening. I'm Jennifer Joseph. I am a mental health worker for the last 30+ years, worked in mental health in Saint Lucia. I'm currently working in Montserrat. I too am a breast cancer survivor of 7 years.
Okay, thank you very much, Jennifer. Okay, Jennifer's been very, from the information I have there, Jennifer has released a book called Lady Under the Stars this month. Okay, she has 30 years experience in the field of mental health policy. Okay, so thank you very much, Jennifer. And you said that you're in Montserrat at the moment. Sorry, you're mute?
Yes, I am.
Okay, how is Montserrat? What's
beautiful,
happening?
Beautiful, but quiet.
Beautiful, but
extremely quiet. Yeah.
Okay, then. Thank you very much for that, Jennifer. And we'll be hearing from Jennifer very shortly. And next is Mrs. Alison Chester. Would you like to introduce yourself? Thank you.
Hi, good evening to all. My name is Alison Chester, and I was first diagnosed in 2017 with breast cancer. And I've been a survivor since then, and I continue to be a survivor and will continue to be a survivor for many, many more years to come.
Okay, thank you very much, Alison. Alison, I don't know where you had your microphone, but we had a little difficulty hearing you. So if, because you're the second speaker, so if you could, look into that, that would be, okay, so that we make sure that everyone can hear you clearly. Alison, also...
Are you hearing me properly now?
Yeah, it's a little better. Yeah, it's a little better. Thanks.
Oh, okay.
Okay. Alison is also the vice president of the Saint Lucia Cancer Society. Okay. So we welcome Alison with us this evening. Our third speaker on the panel on the webinar is Mrs. Monica Felix. You on mute?
I'm on mute.
Yeah, now you go.
Good evening. My name is Monica Felix. I'm a retired nurse. I've been a nurse for 47 years. I was diagnosed with left breast cancer in January of 2018. I went through my treatment in Miami and Martinique. I continue to have my treatment in Saint Lucia. I am also an oncology trained nurse. I did my training at the Royal Marsden in Chelsea. You'll be familiar with that, Solomon.
Yeah.
That's where I did my training. And I need not even talk about the other qualifications I have because it will take the whole evening.
Okay, then thank you very much, Monica. If you don't mind, I call you by your first name. I like to go on a first name basis. Monica is also active. Monica is also active in the Lions Club. Okay, and so we are all here. Okay, we're all here to support each other. So I know cancer. Some people call it the big C, the C they don't want to hear, and everything like that. Okay. I personally, I have, something for me, I have embraced it because I said to myself, you know what? This is my diagnosis. I didn't buy it at JQ Charles, okay, or at Massey Stores. Okay, this is what it is. Okay, I'm going to empower myself. And this is what I've done in the last few years. Really empowered myself in terms of what my diagnosis is, what my kind of cancer is, what my treatment is. And I remember very early, my doctor said to me, okay, my consultant said to me very early, you will end up knowing more about this thing than me because you're the one going through with it. And so we built that relationship from day one. Okay? And he knows, okay, he knows from day one, okay, and how I feel. And he said to me, if you don't tell me how you feel, I will never know how you feel. Okay, I can do blood tests, I can run all kinds of tests, I can do all kinds of scans. However, if you didn't sleep well last night, there's no test I can do to tell me that you didn't sleep well last night. So you are the one that have to tell me. Okay, if you have a pain somewhere, you're the one that have to tell me that you have the pain. Okay, and so we build this relationship, and I call it empowerment for myself. Okay, but tonight is not about me. Okay, tonight is about you. And our first speaker is, Jennifer. And Jennifer is going to tell us when the doctor says cancer. Okay, when the doctor says cancer. So over to you, Jennifer. This is your 10 to 15 minutes. Tell us about it.
Thank you, Mr. Alexis.
Solly is okay.
Thank you, Solomon.
Okay.
The way I'm going to approach the topic is that I'm going to look at the psychosocial impact of a cancer diagnosis from the time you actually first go to the doctor. So I have, Francisca, I have a few slides. So I'm going to share the screen. The slides are a bit, not to minimize the topic, but just to lighten it. I've put it almost in the form of a sort of a comic kind of characters. Yeah. So it's not to minimize it, but just to lighten the atmosphere.
Of course.
Ms. Plummer, can I get the screen shared?
Yes, no? Hang on. You should be able to now.
Just let me know if it can be seen.
Not yet.
Okay.
No?
Not yet, no.
Okay, if not, I can speak without the screen, right? Let me try it again. Okay, I'll give it one more try. If it doesn't work, I will work without it. Can you see it now?
No, not yet.
No,
Okay.
we're not able to.
Okay, so I'm gonna work without it. Okay, so what I have done is looking at the psychosocial impact of a cancer diagnosis, and I have broken it down into five phases. And what do people feel and how does it impact their life throughout those 5 phases? The first phase I've identified is when you go to the doctor. Going to the doctor, what led you to go to the doctor in the first place? Was it a lump you discovered, or was it you were not feeling well, or you're having acid reflux? And even at that point, there is some level of anxiety in your mind because you're not sure what exactly the doctor is going to say to you. And so your mental health is impacted even before you actually get the word of a cancer diagnosis. Secondly, the second phase I have identified is waiting for the results. So between the time you go to the doctor, there is a period when the doctor says, okay, we are going to investigate. And in that waiting period, your level of anxiety will definitely go up. So you maybe have to do blood tests, you maybe have to do scans, ultrasounds, biopsies. And right there and then, if you do not have insurance, that's where the expenditure begins. And for some people, the financial strain even begins before you actually get the diagnosis. So there is an impact on your mental health in terms of depression, anxiety, worrying, well, how am I going to manage, etc. And in the end, we're going to see, we're going to have some, maybe in our discussion on strategies that we can use to cope. The third area is after the big reveal. And the first thing that's going to happen sometimes is denial. I think Dr. Remy made a mistake. I probably going to go to another doctor. I have family in America. I probably go and do a test elsewhere. But the time will come when you will be convinced that what the doctor has said to you is true. For some people, it might take a few days. For some people, they get a high impact, a shock impact, and they're not able to recover. Some people are not able to tell anybody for days about that diagnosis they have. For some of us, the first thing, am I going to die? And then you think of if those who have young children, I have my children. Those who have a husband, I have my husband. Will I lose my marriage? Will I lose my family? And you think of the body part that you're going to lose. Am I going to lose my breast? Because these parts of your body are very, very, very important to you. So again, there is emotions like fear, there's anxiety, there's worry while you wait for those results to come in. And sometimes, from my experience in Saint Lucia, the results may take weeks, and all this time, your level of anxiety is increasing, and you are irritable with people around you. It affects your performance on the job. It affects your family relationship. You want to be alone. You want to, not be with people, and waiting for that telephone call when the doctor asks you to come back in to see them to discuss the findings of the various tests that you did. And the other area I identified that where psychosocial is impacted is during treatment. And in fact, one area I forgot to mention before treatment, there's a level of planning. And in that level of planning, it involves whether you actually have treatment in Saint Lucia or whether you travel overseas. And again, right away, you could see what the cost implications are. Going overseas is very difficult. You may have to make the difficult decision of leaving your family behind, leaving your young children behind in the care of other people. And it impacts you if you go overseas during treatment now, it impacts your whole wellness because you're worried if the children are eating properly, if the children are going to school, if the children are adjusting properly to the treatment, if the children are actually understanding what you're going through. And during treatment, you say the thing that you say is hard. You have it, you figure, okay, I've seen videos, I've seen movies of people losing their hair, people have upset stomach, people are going through all these things. but then it happens to me. And you say, that was the last thing I ever expected to happen to me. And during treatment, again, all these rush of emotions come in. And I have to say here that people are not crazy. All these reactions are normal reactions because these are very stressful life events. I've noticed recently that everybody's saying you need professional help. When you have an event, if you cut your body, you cut your hand, you bleed. It's a natural reaction, and the bleeding is going to stop if you apply pressure. If it's necessary, then you may go to the hospital to get stitches. But your reaction to a cancer diagnosis is normal for you to feel anxious, for you to feel worried. The only time that there is concern is if it's really, really adversely impacting your social functioning, your ability to work, your ability to have your relationships with other people, and your ability to just love yourself and to be who you are. And the final phase I identify is after treatment. So people figure, okay, it's over, and we jump and we rejoice. But there are lots of issues that come up in our lives after treatment. For example, you have a lady who has had her breast amputated. There are issues of intimacy, which not everybody would like to expose themselves to. That important part of your body is important in relationships. How do you, in terms of love, in terms of having an intimate relationship with your partner? Some people have a lot of difficulty exposing that part of the body. Sometimes not even necessarily losing the entire breast, but it could be necessarily just having a scar and having to expose that scar to other people. For some people, it's no big thing. They're on internet and everywhere exposing the chest without breast. It's not a problem for some people, but for others, it impacts the whole relationships. I remember attending a support group when I was going through treatment, and this lady said she's not going to go back with her partner. She will not be able to have a relationship without her breast. So many things that other people may take for granted, it might be impacting other people. After treatments, sometimes you have the bills that you have incurred, and you have to wonder how you're going to get them paid. So you have the financial stress, the financial worries, and also it can go on, it can continue. Another area of anxiety for people after treatment is that you never relax, because even though you go for tests over and over and say, okay, you're cancer free, there is always that worry in the back of your mind that the cancer is going to return. So you live with that from a day-to-day basis. Some people might say, okay, not a problem, but some people may worry and say, okay, if these things come back. I personally said, if it comes back, I will not go through treatment again. I don't know at the time. So to show you at the time what people are thinking, even through having a cancer diagnosis. So later on, when we discuss, maybe the group can share with us, we can discuss strategies on how people manage to cope with the negative feelings and the negative thoughts that they had in their head throughout the cycle of cancer treatment, from the time the doctor mentioned to you that you do have a diagnosis of a cancer diagnosis. So I round off here until if anybody has any comments, or Mr. Alexis Solomon will take over from here. Thank you.
Yeah, thank you very much for that. Thank you very much for that. We do appreciate that. I have one question, because it's one of the things that started, in the very beginning. What time in your experience do you see that people tell other people about their condition or their diagnosis?
That's a tough question, because there are some people who are very secretive, and for me, it took me about a day. I didn't talk about it until the next day. So, and I think talking about it helped a lot, because you have people who, not people who busybody and want to know your business, but people who who's genuinely concerned about you, who are going to support you in whatever you're going through.
Okay, thank you for that. Does anybody in the group have any question that they would like to ask at this time? But there will be a further opportunity later this evening. But anybody want to say anything? Okay, I see there are no questions in the chat, but if you want, you can type up your question in the chat and we can always ask the panel. I'm following the chat from my end here too. Let me, you know, just before I let you go, I would say, you know, when I was diagnosed, when I was told that I didn't hear the word cancer. Okay, I heard multiple myeloma. I didn't know what it was, and I'm just there thinking, okay, let's get this done with. It's when the doctor said you need to start chemotherapy. I then thought, okay, now the only time I've heard chemotherapy is when we're talking about cancer. Okay, and I said, okay, I'm sitting there. So first thing is the word cancer. Second thing, okay, I was told is your type of cancer, there's no cure for it. There's treatment, but there isn't a cure. And within 3 minutes, I'm told, okay, the treatment that you're going on can give you a secondary cancer. And I'm sitting there and I'm thinking, then I'm dead. Okay, this is what I'm sitting down there thinking, I'm dead. Okay, so within 10 minutes, I had all of these emotions going through me. And also, what I realized, I came home, it was a Friday, and guess what? By Friday night, I had diarrhea. Serious, you know, in Saint Lucia parlance, we call it lagigit, okay? And that went on the Friday, Saturday. My friends came to visit me. I told them it was diarrhea that I have. You know, they brought me haddo bread. They brought me Pepto-Bismol. And I'm thinking, if you only knew what I'm going through. Anyway, to make it short, by Tuesday, I got up and I tell myself, shake this thing around. You ain't dead yet, okay? And I move on. But in terms of the first question that I asked about, you know, how long you tell people, I started telling people almost immediately. Of course, I'm a family and close friends, okay? And some people, after 2 years, I still have not told them, okay? But of course, now a lot of people now know. But, you know, it's that range of emotions that you go through. And some people think that, oh, if you don't tell them, oh, I thought you were my friend and you'd always tell me and everything like that. And especially nowadays with, you know, with social media, you send a voice note and it's everywhere already. You send a WhatsApp message, tout monde dit, okay, and thing. But anyway, so this is where we start. This is where we start our journey. So we have our next speaker, okay, and I don't want to take too much time, and it is Alison. Alison is going to tell us about treatment, getting started.
Thank you, Carol.
Yeah.
I don't think I'm as dynamic as the other two ladies, but I'm going to try my best. When you're told you have cancer, there are a number of things you have to put in place as well as things that you have to do. The first thing is find a partner. No one should go through the fight against cancer alone. So you can either your spouse, a sibling, an offspring, a friend, anyone that you can trust that will listen to whatever the doctor tells you and will be able to confirm what you heard. Then you need to get organized. You can start a notebook or a binder to coordinate your appointment, your treatment, the doctor's phone numbers, any information that you collect along the way, and you take it with you at each medical appointment. You also make note of all the questions that you would like to ask, because there are a lot of questions that will come up in your mind that you will want to ask the doctor. And when you're there in front of the doctor, you don't remember those questions. And testimony for that. So one thing I did not do was I did not write down any questions. If I knew I had questions to ask, but when I got in front of the doctor, I couldn't remember what I wanted to ask. So it's important that you start making notes of all the little questions that you would like to ask the doctor. Then you get informed. You take steps to learn more about what cancer you have. So you go searching on the web, but you make sure that you try to go to sources that are that can give you exactly the information exactly what you want. Some of the websites could be WebMD, the American Cancer Society, there is cancer.org, but there are different websites that you can go on that can tell you, help you along the way to find out more about whatever cancer you have, whether it's breast cancer, lung cancer, multiple myeloma, any cancers that you have, you go and you do your own research and you take note of the information, but don't take in too much. Some people like a lot of information, some people just like a little. Me, I wanted to know everything, and there was nobody to tell me anything, so I did my own research and found my information for myself. Then you have to be able to consult only, like I say, only unbiased and worthy sources, trustworthy sources when you do your research. Then treatment for cancer, it can be highly complex and individualized because everybody's cancer treatment would be different. Because even though we might have breast cancer the same way, mine, depending on your stage, it depends on your age, it depends on your health. So your treatment will be different from somebody else's treatment. To make informed decisions, you will need to understand your cancer treatment options. And it starts from, well, we go through biopsy, that's how they know that you have a cancer, because the biopsy they take, it's tested, and then you get the results that says that you have cancer. So the next step for most is surgery. And surgery could be major or minor, and that's an operation to remove the cancer. You have chemotherapy using anti-cancer medication that acts throughout your body. Then you have radiation therapy. And this uses high energy beams or implants to kill cancer cells. And then there's immunotherapy. Immunotherapy is using products of the immune system as medicine against the cancer. Francisco, could you start the first slide, please?
Oh, give me 1 second, sorry.
Yeah. I'll fire you.
Yes, you caught me off guard. 1 second, I got it. Okay.
Okay, so one of the things, the first thing that it would be good to do is communicating with friends and family, your family members. Support from family and friends after cancer diagnosis can be literally life-saving. At the same time, experts warn dealing with all the well-wishers can be a lot. The key is getting the support you need while reserving time and energy for treatment and recovery. And a few guidelines to help: don't hide your cancer diagnosis. Don't hide your cancer diagnosis. Protecting children or others from the bad news usually makes the situation worse. When people ask if they can help, give them specific tasks. Driving you to an appointment or helping with childcare are some of the examples. Maybe helping you prepare meals, doing laundry, but be specific. Let them know exactly what they can do to help you. Designate a contact person to share information among your family and friends, because you don't want to be bombarded with all questions about, you know, what you're going through, because you're going through this and it can be tasking on you going through cancer. So designate a contact person. This person is the one who will give people information that they think they need. And expect awkward conversation, because even inadvertently hurtful comments or behavior from well-meaning friends, you will get that. So you have to try and expect that, because people will come to you, they don't know what to tell you, they don't know how to react because you told them that you have cancer. Then you have to look into financial self-care. A cancer diagnosis requires a financial action plan as well as a medical one. Budgeting for healthcare costs and ensuring your family security require advanced planning. Regardless of income, everyone should consider the potential financial impact of a cancer diagnosis. If you do not have insurance, make inquiries about where you can get one. Insurance makes a big difference in cancer care. Read your plan carefully and talk to your provider about your cancer diagnosis. If you do not have insurance, make inquiries about where you might be able to get some financial help. Some of the places you can get financial help in Saint Lucia that I found out after is the NCF, the Ministry of Health. We have a medical assistance unit. Places of Cancer also help, and Saint Lucia Cancer Society helps to appoint to help you. So look into these financial areas that you can get help, because cancer is a financial stress, because chemotherapy, radiation, all these cost some money. Okay. Then the last point I want to touch on is taking care of you. Taking care of yourself after cancer diagnosis may be the most important task of all and the most overlooked. Work obligations and other roles such as parents, spouse, or caregiver will compete for your time and energy. So rule number one is your treatment comes first. Put your own oxygen mask on before helping others. They always tell you that in an airplane, right? If we're experiencing turbulence and trouble and we drop the oxygen mask, put your own on first before trying to help others. After a cancer diagnosis, you owe it to yourself to be your own number one caregiver. Your personal care should include the following. Try to keep life as normal as possible. You're more than a cancer patient. You're who you were before your cancer diagnosis. Exercise as much as you can. That part, I was never an exercise person, and I learned about exercising long after my surgery, and the exercise before could help you in your recovery and will help you to recover as fast as possible. Exercise as much as possible. Short walk, even simple stretching will help. Staying positive is important. However, expressing your feelings, even ones that seem negative, is even more important. Learn to rely on others. Share your responsibilities to childcare or elder care with others. Let others help you with your responsibilities. Consider speaking with a mental health professional, particularly if you are depressed or you suffer anxiety from hearing about your diagnosis. Therapy can help relieve the stress of a cancer diagnosis and give you a safe place to express your fears and hopes for the future. Your cancer team would include the surgeon, the oncologist, and oncologist nurse, and always try to source a support group. Like we have Pillars of Hope with the Saint Lucia Cancer Society. Always find yourself into a support group, because there are persons there who are going through what you're going through or have been through what you're now going through, and you can talk. It's a space where you can talk and know that you have confidentiality there, and the advice you'll be getting is advice that people have already been through. So a support group is good to have. Okay, I don't know if I've covered the topic that I was given, but I sure hope I did. Thank you. If you have any questions, I will try my best to
answer. Thank you very much, Alison, for that. Yes, you did cover the topic. Okay, and we'd like to thank you very much. You know, getting started is a big thing. I mean, you mentioned the money thing, the financial aspect. Okay, this is, I think for many patients, especially in St. Lucia, that is the number one thing. Okay, because your cancer treatment is almost going to be dependent on, you know, where you're going to get the money from and how much money that you have and what kind of treatment that you can get. And if you can leave the island and go somewhere else, and, you know, all of these kinds of things. So that is very important. And, you know, maybe for us who already diagnosed, getting insurance is too late now. I know no insurance going to take us on. Okay, so and maybe that is something we need to drum into people who are not diagnosed yet. Get insurance. Okay, no matter how little that it helps. Yes, you'll pay for it now, but then you never know what it will be in the future. I have no questions in the chat, but I'll ask you a question. Did you, because that's one of the first things that, after I was diagnosed, people start coming to me with is, what should you eat? What should you drink? Okay, and they started bringing all kinds of things to me. Imagine I'm in England. I never see soursop like that. People started bringing soursop for me. I swear soursop was growing in England. Okay, what's your take? Well, not your take, but did you have that kind of experience with people telling you, drink smoothies, eat this, drink that, rub that, smoke that, inhale that? What's your experience there? You on mute, sorry.
Sorry. Person just tell me that one of the things that is good to help cure cancer is using cannabis. And I'm like, okay, well, I will find another route to help with this cancer, not me and cannabis. They said, you grind the leaf and then every morning you take a spoonful in water and you drink that and the person that told me that they had a sister who was a cancer patient, and unfortunately, that's what she was doing, but unfortunately, she died.
Yeah.
So, but reading and searching the internet, it was like a lot of information, and I had to decipher what makes sense to me. And one of the things that keep coming up was the soursop leaf, boiling it and drinking the water. And I did that. I was doing that during my journey, because of after every chemo you had to get a blood test. So the blood count has to be up for it when it stops the chemo. So I used to use a lot of smoothies, and my smoothies always have kale, chia seeds, flax seeds, always with bananas and sometimes coconut milk I use to make the smoothie. But I always used to do smoothies. Nowadays I have slackened a bit, but I think I need to get back on that because it really helps. My blood count is always on par. But the only thing people used to tell me a lot of is that I just use that sometimes.
Okay then. Yeah, thanks very much. In the chat, Unita said that it was Nuni, something called Nuni. Do I have it? Did I pronounce it
Oh,
well?
Noni.
Noni.
Yeah, some people say about noni. I tasted that and I didn't like it.
Okay.
So it would not have done anything good to me.
Okay. Yeah.
Unetta also has her hand up, Solomon.
Yeah. Yes. I was just coming to that.
Yeah.
Yeah. Unita, you want to come in?
Good evening.
Good evening.
Yeah, from Antigua. Very good program. Nice to be part of this forum. And I'm a breast cancer survivor of 23 years. Wow. Thank God for that. Yes. And I'm also the president of a breast cancer support group in Antigua and Barbuda. And I really enjoyed the presentation, the two presentations so far. And yes, when we consider all the psychological and emotional impact of a cancer diagnosis, is really something that we all as cancer survivors have to consider, and to help those who are newly diagnosed to guide them through the process, because it's a very stressful time for such persons. And the anxiety, the denial, the shock, the fear. Remember when I was diagnosed, my children were young. My daughter was just writing her common entrance exam to go into secondary school. And all I could think about, where am I going to live? Am I going to see my children grow up? And things of that sort. So forums like these are very, very important to help cancer survivors and to share information and be able to share what you're going through and how you, the coping skills that you can share with each other. So compliments for a very good forum.
Okay, thank you very much for that, Unita. And you see, in every adversity, we get ways in which to think. Maybe if it wasn't for COVID, would be having this in a hall somewhere, in a room somewhere, and then we would not have our friends from Antigua and Barbuda. So welcome. I think we said the Antigua and Barbuda Diabetes Association, and also the Antigua Breast Friends Cancer Support Group. Okay, so welcome. Okay, and I know we also have people from, I can see there that I can see one of my friends there is currently in France. Okay, so we have people from France. I heard Monstrat earlier on. Okay, so where do we have people from now? Anybody want to tell me where they're from? I know Saint Lucia, I know France. Sorry?
No, I was saying Saint Lucia.
Yes, definitely Saint Lucia.
Ola is in the house, Solomon. My niece is on.
Yeah, sorry, I didn't hear that. Who's in the house?
Totola, Bofa Industrious. He's from Totola.
Okay,
she's
lovely.
My niece and she's listening, and among a few other friends I have there, both here and overseas. Okay, thank you. Welcome, Totola and the others. We have Maryland in the USA, as I can see there. Okay, that's my sister, so I should know where she is. Okay, she had better be home. Okay, yeah, I can see her. Yeah, she's in the house too. Okay, thank you very much for that. And let me see. Yeah. So what I'll do now is that I'll call on our third speaker, and after that, we'll have a general discussion. Managing this. Yeah, sorry.
Just before you go on, I got a comment from a consultant, and she just about treatment in general. I thought I would share in the group. She's not able to come on. She's into meetings, but she says before deciding on treatment, the doctor-patient conversation and non-cancer screening tests are very important. She talks about the cardiac assessment, for example, and says too often we see after commencement of treatment with cardiotoxic drugs. She says that patients survive cancer but never get to know about the heart complications until late. Her recommendation is that screening will certainly help decide on choosing which drugs for chemotherapy. So just thought I would put that in the group.
Yeah, thank you very much for that. In my case, I resonate with this very much, because in my case, even before treatment was started for me, we did they looked at my heart, they looked at my kidneys, they looked at my pancreas, my liver, everything they looked at before I had the first big drug going into me. And that is because a lot of the treatment, as we all know, they're very toxic, okay, and they can cause a lot of problems. And this is why I am, in a way, I'm lucky, because I have I do blood tests, once a month, sometimes twice a month, just to check on everything. And so on almost sometimes a weekly basis, I can tell you what my potassium levels are, what my sodium levels are, what my creatinine levels are, plus all the other things that you get with the full blood count and everything. So it's very, very important, that is thought about, and if it can be done, it is one thing I would highly encourage everyone to get done. Okay, so thank you very much for that. And friends, as I said, if you want to, I have my niece also. My niece is on, Anesta. Good afternoon, good evening. Okay, somebody's putting a message there to say hello, Dr. Remy. So I'm just reading out your comments there. Okay, so yes. So our next speaker is, it's on the screen there. The effects of treatment. Monica Felix. Monica?
You have to unmute yourself, Monica. You're muted.
I'm sorry. Good evening, viewers on the virtual platform, friends, warriors, survivors, etc. Welcome. This evening, we will be looking at our objectives this evening. We'll be looking at the overview of chemotherapy, why it's done, chemotherapy for conditions other than cancer, the risk, side effects on late developing side effects, how to prepare, what you can expect, how often you receive chemotherapy treatment, where you receive chemotherapy treatment, results, and references. So as anything else, let us look at a review of chemotherapy. Let us see what it is. Chemotherapy is a drug treatment that uses, let's bear with me, the picture is blocking my, okay. Chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Chemotherapy is most often used to treat cancer, since cancer cells grow and multiply much more quickly than most cells in the body. Next slide. Many different chemotherapy drugs are available. Chemotherapy drugs can be used alone or in combination to treat a wide variety of cancers. Though chemotherapy is an effective way to treat many types of cancer, chemotherapy treatment also carries a risk of side effects. Some chemotherapy side effects are mild and treatable, while others can cause serious complications, and we will get into some of them. Okay, as anything else, why is chemotherapy done? Chemotherapy is used to kill cancer cells in people with cancer. There are a variety of settings in which chemotherapy may be used in people with cancer. One, it is to cure the cancer without other treatments. Chemotherapy can be used as the primary or sole treatment for cancer. Two, after other treatments to kill hidden cancer cells. Chemotherapy can be used after other treatments such as surgery to kill any other cancer cells that might remain in the body. Doctors call this adjuvant chemotherapy. Many times we hear the doctor says, or your team, your medical team says, you should have chemotherapy before you have surgery, and it can be vice versa. In some cases, you can have the surgery before, you can have it after the cycles of chemotherapy. It is done to prepare you for other treatments. Chemotherapy can be used to shrink a tumor so that chemotherapy can be used to shrink a tumor so that other treatments such as radiation and surgery are possible. Doctors call this neoadjuvant therapy. It is done to ease signs and symptoms. Chemotherapy may help relieve signs and symptoms of cancer by killing some of the cancer cells.
Now, just a very good forum.
Should I continue?
Yes, please continue. I muted the person.
Okay. Some chemotherapy drugs have proved useful in treating other conditions such as one, bone marrow diseases, and diseases that affect the bone marrow and blood cells may be treated with a bone marrow transplant, also known as stem cell transplant. And we heard of stem cell with Solomon. Chemotherapy is often used to prepare for a bone marrow transplant. It can be used for immune system disorders. Lower doses of chemotherapy drugs can help control an overactive immune system in certain diseases such as lupus and rheumatoid arthritis. So it is not only for chemotherapy is not only given for cancer use, as you can see. The risk of chemotherapy. Side effects of chemotherapy drugs can be significant. Each drug has different side effects, and not every drug causes every side effect. Ask your doctor about the side effects of the particular drug you will receive. And what I need to say is as well, because of our body mechanics, what worked for me may not work for you. My experience may not be your experience. And as we go through the side effects, some of us may not experience certain side effects that is on the screen as well. So it depends on our body mechanics. So common side effects of chemotherapy drugs include nausea. You may feel very nauseous, like you want to vomit and you can't vomit. Vomiting, you can experience vomiting, but we have moved a step forward with treatment for nausea and vomiting that is very much controlled. But I remember maybe a good 15 years ago when I used to administer chemotherapy at Victoria Hospital. In spite of some of the pre-meds we give for vomiting and nausea, some people will tell you when they get home, they vomited so much and they got weak and so. But with the advent of upgraded drugs, I think a lot of people are being spared with the nausea and the vomiting. Diarrhea is evident, hair loss of appetite, fatigue, fever, mouth sores. You can experience pain, constipation, easy bruising, bleeding. And I must say, I would like to expand a little on some of the side effects, because you can have diarrhea this week and you can have constipation next week, because I experienced both of them. One time I had diarrhea, another time I had constipation. And this constipation is nothing easy. And what I need to, let me just stray away a little. I am thankful for this presentation, because most times people who have not experienced or have not gone through chemotherapy come and they do the lecture. But I think for those of us here, we are the ideal persons to talk about it, because we have walked the walk and we have danced the dance. And I remember certain things I used to tell patients rather, to look out for. Telling the clients to look out for one thing and experiencing it for yourself is something else. So anyway, loss of appetite is another horrible one as well, because you have no appetite, and when you do feel like eating something, you have to, for me, I would have to, if I ask for soup, I had to drink the soup in less than a quarter of a minute, because I had to gobble it now and I don't want to see it again. Then as for the fatigue, you are always tired, you do not have the energy, and if you do not have the good support system to assist you, you can break down very, very easily, because sometimes you don't have. I've spoken to patients who says they are at home alone, they have nobody to cook for them, and they have to try and get them on day after chemotherapy, and it's not a very good experience. This is why I have we must have a good support system. Hair loss is something just like Jennifer said earlier on, body image. Sometimes we cannot cope with a mastectomy because we do not want our partner to see that we are missing a breast. And so it's the same as hair loss, because sometimes you have very long hair, and if you are not educated as to what to do or advised as to what to do and you start chemotherapy, all this hair is staying on your pillow, especially if you have long hair. it is not a very good site. So before the treatment, the oncology team, the multidisciplinary team, need to sit and advise patients as to what to do, trim their hair, and a few other things. Fever, as anything else, you can have fever, mouth sores, you can have because of the membranes in your mouth is so delicate, and your skin to get very, very thin, so you can easily bruise, and they can be bleeding. Many of these side effects can be prevented or treated. Most side effects subside after treatment ends. One side effect I didn't see there is scaly feet. If you are, for some of us, if you are on chemotherapy regime, you can have a lot of dry skin, and you can actually, for me, I could actually like peel a whole sheet of dry skin under my feet. And the more I do pedicures, like I do have a pedicure Thursday, and by Sunday, my feet is so dry and peeling off. So there are a lot more things that you can experience. Some of the long-lasting and late-developing side effects, chemotherapy drugs can also cause side effects that don't become evident until months or years after treatment. Late side effects vary depending on the chemotherapy drug, but can include damage to lung tissue, heart problems, as we spoke earlier, and we spoke about going for the echocardiogram on every 3 months. These are things you must do. Infertility, in some cases, you have to donate eggs, store eggs in the lab. So afterwards, if you decide to have a kid, or even for the men, you do sperm banking. Kidney problems, nerve damage, peripheral neuropathy, especially your fingers and your feet. And as Solomon said, the risk of second cancer. Ask your doctor if you have a risk of any late side effects. Ask what signs and symptoms you should be aware of that may signal a problem. We need to communicate with our oncologists and the team that is around us. We need to communicate. So how you can prepare for all of that? You prepare for your preparation for chemotherapy depends on which drugs you will receive and how they will be administered. No two persons will be getting the same drugs, the same chemo drugs, because for breast cancer, you have 17 different types of breast cancer, and you have over 200 different types of cancers. So no two persons may end up having the same treatment. But you will need to prepare for it. First, have a device surgically inserted before intravenous chemotherapy. If you'll be receiving your chemotherapy intravenously into a vein, your doctor may recommend a device, such as a catheter or a pot or a pump. The catheter or other devices is surgically implanted into a large vein, usually in your chest. Chemotherapy drugs can be given through that device. I opted for a pot because I do not have nice veins, and knowing the danger of extravasation in your veins if you do not have good veins. I have advised other persons to put in a pot. It's costing a bit of money. I think it's 1,000 and change, but I think I am better off with a pot than going into my tiny veins and end up with an amputated arm, etc. Because chemotherapy in your tissue can cause havoc. However, on-the-go tests and procedures to make sure your body is ready to receive chemotherapy. We spoke about that earlier. You need a blood test to check kidney and liver functions and heart tests to check for heart health. And that can determine whether your body is ready to begin chemotherapy. If there is a problem, your doctor may delay your treatment or select a different chemotherapy drug and dosage that is safer for you. Many a times we go up, and for me, for the last 2 months, there is a particular drug I was not able to take because a few of my labs were not normal, they were too low. So it can cause a problem. So you need to check with your doctor to continue your medication. It is important to see your dentist. Your doctor may recommend that a dentist check your teeth for signs of infection. Treating existing infection may reduce the risk of complications during chemotherapy treatment, since some chemotherapy may reduce your body's ability to fight infections. Plan ahead for side effects. Ask your doctor what side effects to expect during and after chemotherapy and make appropriate arrangements, as Alison said. For instance, if your chemotherapy treatment will cause infertility, you may wish to consider your options for preserving your sperm or eggs for future use. If your chemotherapy will cause hair loss, consider planning for a hair covering. Make arrangements for help at home and at work. Most chemotherapy treatments are given in an outpatient clinic, which means most people are able to continue working and doing their usual activities during chemotherapy. Your doctor can tell you in general how much the chemotherapy will affect your usual activities, but it's difficult to predict exactly how you will feel. So true. Ask your doctor if you will need time off work or help around your home after treatment. Ask your doctor for the details of your chemotherapy treatment so that you can make arrangements for work, children, pets, or other commitments. Prepare for your first treatment. Ask your doctor or chemotherapy nurses how to prepare for chemotherapy. It may be helpful to arrive for your first chemotherapy treatment well rested. You might wish to eat a light meal beforehand in case your chemotherapy medication causes nausea. Have a friend or family member drive you to your first treatment. Most people can drive themselves to and from chemotherapy sessions, but the first time you may find that the medications make you sleepy or cause other side effects that make driving difficult. This is so true, because most times I can drive myself up, but to come now I need a driver to drive me because of the medication that's given to me, especially the pre-meds. Okay, what you can expect. Determining which chemotherapy drugs you will receive. Your doctor chooses your chemotherapy drugs you will receive based on several factors, including 1, type of cancer, the stage of your cancer, your overall health, previous cancer treatments, your goals and preferences. Discuss your treatment options with your doctor. Together, you can decide what's right for you. And as you notice, every slide refers you to discussing things with your doctor or your oncology nurse or the multidisciplinary team that is around you. How often you receive chemotherapy treatment? Your doctor determines how often you receive chemotherapy treatment based on what drugs you receive, the characteristics of your cancer, and how well your body recovers after each treatment. Chemotherapy treatment schedules vary. Chemotherapy treatment can be continuous, or it may alternate between periods of treatment and periods to rest to let you recover. And we have what you call the cell cycle as well. Some of us, we will realize that in having the chemotherapy, we take it and every 3 weeks we go back. So which means we need the body to rejuvenate, and also we need the cell cycle to rejuvenate as well. Okay, where you receive chemotherapy treatments, Where you will receive your chemotherapy treatment depends on your situation. Chemotherapy treatment can be given in an outpatient chemotherapy unit, in a doctor's office, in the hospital, at home, such as when taking chemotherapy pills, because we do have chemotherapy pills that you can swallow. And depending on the type of medication you are having, you may have to go into hospital because you need to be under observation. You can have it in a doctor's office right there. Some of our oncologists do administer chemotherapy in the office. I remember I have administered it right in our community hospital where I live to patients to decrease the cost, because sometimes it's difficult for patients to travel from one point to the next. Results, let's look at the results. You will meet with your cancer doctor, which is your oncologist, regularly during chemotherapy treatment. As a matter of fact, every clinic you attend, you're supposed to have a little consultation with your oncologist. Your oncologist will ask about any side effects you're experiencing, since many can be controlled. So what I would advise is, if you notice anything different, take note of it, write your questions. So when you get to the clinic, you can discuss it with your doctor, because sometimes I say to myself, I have a chemotherapy brain. Sometimes you may forget, so we need to write. Depending on your situation, you may also undergo scans and other tests to monitor your cancer during chemotherapy treatment. These tests can give your doctor an idea of how your cancer is responding to treatment, and your treatment may be adjusted accordingly. For me, as for example, to every time I go up to Miami, I do see an oncologist in Miami. I have to do the PET scans and the mammograms and all the different stuff that can guide us, so we can know where we are at, as the slide says. And this is the reference which you can log into and do some more reading. Thank you.
Okay, thank you very, very much for that. You know, the managing the side effects of chemotherapy is a big thing. Okay,
it is.
Okay, one of the things I would say is, you know, for you to know yourself. Okay, for you to know your body, for you to know, you know, when it is that you're going through the various side effects that you're going through. Okay, you need to be in tune with yourself. Okay, and I got that from your presentation. Just looking at the questions there. Somebody asked, there was a question there, yeah, from Buffer. Buffer says, when you mentioned dry skin, Buffer says, what do you use for dry skin?
Okay, well, can I say what I use?
Yeah.
I use bicarbonate of soda and vinegar. I used to soak my feet in that very often, and it helped, but just for a few days. But what I was able to do, I bought Cetaphil ointment. And we can't afford that in Saint Lucia. You have to buy that overseas.
Yeah, okay.
So I used, and I'm still using Cetaphil ointment, and also Vaseline. At nights, I would put the Vaseline on, and then I would put a pair of socks on so it don't soil my linen, and it will keep my feet very, very nice.
Okay. Yeah, thanks for that. And let me see. I think Unita wanted to say, Unita, do you want to say, because you had a long comment in the chat there, and I'll just give you an opportunity to just, or do you want me to read it out?
Who are you referring to? Sorry.
No, Unita Bird.
Oh, hi. Okay.
Yeah.
Yes, I was just, you know, some of the side effects from treatment. such as my hair loss, because I
Yeah.
love my hair. And I think the hair loss impacted me more than anything else during my treatment, psychologically, emotionally, because I think my self-esteem took a nosedive, and I really had a hard time coping with my appearance and stuff like that. But joining a support group and sharing with others and see how others cope, I was able to deal with it much better. So anybody who going through that, just speak to others who have been through the same experience, and you'll be able to get some information and coping skills. Thank you.
Okay, thank you very much for that. Okay, now yeah, Jennifer Joseph, I think she says that she used something called Aquaphor for it's good for dry skin after radiation. And although we are not making any prescription here on medication. Okay, so this is just from this group here. Okay. I would also like to say, one of the things, we're talking about managing the effects of treatment. When I saw your list of possible side effects there, I see that I go through so many of them. I have my family knows that now, but I have my Thursday nights are massive nights for me, okay? Because I have an injection that I need to take, and I used to be afraid of injections. Now I'm a pro, okay? I can give myself injections now, okay? And filgrastim is, one of the injections that I have to give myself. And
I do that too. I do that.
And within 30 minutes of taking filgrastim, let me tell you, I could call the paramedics. Okay, I have stuffy nose, my chest is hurting me, my eyes are running, my throat is hurting me, I get fever, I get chills and everything. In fact, last Thursday, I was on the phone speaking to my sister, and she realized that I was not responding as usual. I literally crawled up to go to bed. I was so weak that I could not even put the cover over me. Okay, but I know that by 2 o'clock in the morning, I will get up. I'm sweating profusely. I will change my pajama, and I know it would be over by then. Okay, and this is what happens every Tuesday night. Okay, Thursday night. Okay, and then I have dexamethasone and all the others taken. But in terms of treatment, there's the chemotherapy drugs, okay, or medication. And then there's the medication that you're taking to prevent all the other things. I think it's called prophylactic or something like that. Okay, Mapia's doctor. Sorry, I'm not a doctor. I just realized. Okay, and then, so I have more drugs to prevent things from happening than the drugs to cure me. Okay, so I have a drug, it's like you said, they give me a drug for constipation, and then they give me one for diarrhea. And I'm thinking,
yes.
Just the thing that's causing that, let's just take it out. You understand? So you have one for constipation, you have one for diarrhea. You have one for if you cannot sleep, take that if you cannot sleep. Okay? And then you have another one to make you wake up in the morning. And it's the opposite of everything that's going on. Okay? But it's a journey that we go through. Yeah, go ahead.
Listen, Solomon. Whilst I was in Martinique, I met a few people who has breast cancer as well, and even hair as well. So everybody I've heard who speak about chemotherapy, they tell you they do not want this for their worst enemy, because it is not a nice journey. Chemotherapy journey is not a nice one, and even radiation is another one.
Yeah.
And I can give 100 examples. I remember when I went over to Martinique, I lived with a friend, but every day I had to go to the hospital for the radiation. But where I was staying is almost like the countryside in a place called Lamante. But she has some nice mango trees and things around. So I think I'm strong enough. So every morning I said, I must have a little swing. I cannot just sit at my friend's home and don't do anything. So I would take a rake and rake all the leaves and go and dump it and so. But after I had about the 4th fraction of radiation. When I came back, I couldn't do that anymore. I had to, when I come from the hospital, all I could do was to lay in bed until I build up some energy again and then start, get something to eat. You have no appetite, you are tired, you know. But apart from that, the tiredness, you have to deal with the burns. Because I ended up with burns to my breast because I did not have a mastectomy, I had a lumpectomy. So you have the burns to deal with. And listen, sometimes people just don't understand what we go through and what we are going through. And even your patients to the chemotherapy works on your patients because you get sometimes so agitated that you just tell yourself, Lord, just help me.
Yeah. Okay. Thanks for that. I would like to thank. We had 3 wonderful speakers today. Okay, 3 wonderful guests. Okay, and we went through the journey. I know there's a lot that we can pack into this. Okay, when the doctor says cancer, okay, Jennifer told us about that. She told us of her experience there. Okay, and what happened. Then we move into getting started, and Alison told us about her own experience in getting started and the various things that comes to mind, talking to people, looking after finances, everything like that. Okay, and of course we have Monica now telling us about the side effects, the effects of treatment, etc. So I'd like to thank you for bringing us together in that journey. I call it a journey. Okay, personally I write about it. Up to this morning, I wrote a little piece about how I was feeling and what was happening. Because for me, my father taught me one thing. He said, listen, a short pencil is better than a long memory. Okay, so if you have it, take a note of it. Okay, just as I think it was Alison who said, when you're ready to go and see the doctor, make a list of the questions that you want to ask. So I write things down. Well, not really right now, I type it out. Okay, but I make sure that I have it there because so much can happen, and sometimes you get confused. Chemo brain is a serious thing. Okay, you do get confused. So I'd like now to use the next about 10-15 minutes in case anybody have any questions that they would like to hear, or any of your own experience, but bearing in mind the time that it is. So I will keep it down to about 10-15 minutes. Okay, but if anybody would like to come in, you can use the hand raise feature on I almost said Teams, but on Zoom. Use the hand raise feature. I will call on you, and or you can put it in the chat room, and we'll bring it back out. So the floor is now open to everyone. Who wants to come in first? You can ask a question. You can make a comment. You can. Everybody's shy.
Whilst we are waiting, Solomon, I just wanted to speak a little on the financial impact. Chemotherapy drug is very expensive. Yeah. And if you were to get the top of the line treatment, you need finances. And I remember at the beginning, you did say that for those of us who are not suffering from any ailments as yet, I think this is the right time to look into having a health insurance. Because imagine yesterday I had to purchase a drug in Florida, and it's a 28-day cycle, and it's costing me $21,000 for 28 days, and I don't know how long I will need it for because I've been taking it from October of last year. So it is a financial burden, and for those of us who are working, I think you never know, because none of us know what is going to happen. In 2017, I was at the waterfront talking about breast cancer, and my club has we every October we have an awareness. We create an awareness in the community where we have a church service. From there, we go to the Sutra waterfront. We give different speeches. The persons come in and they give some they share their information just like we are doing here. And then we released some sky lanterns. And there I was. And by January, I went for my pap smear. I never felt any lump. For those of us who are looking for a lump, please don't always look for a lump. I never felt any lump. And I decided to go for my pap smear. And when the doctor, my gynecologist, examined my breast, she told me she felt a thickening in my left breast. She sent me for a mammogram. And then the mammogram and the ultrasound picked it up. But my oncologist in Miami told me the location of the lump, I would have never felt it because it was deep inside. On my own, I would not have felt it. Yeah. So I'm just creating that kind of awareness. Sometimes we look for a lump, you may see a lump, and as I said earlier, both persons are the same. So please take note of your health check and take it on from there, because chemotherapy is very expensive. This drug is costing me more than the radiation I had in Martinique. And I had 24 fractions of radiation in Martinique, and it did not cost me the cost of this one drug I have to get, and it's just for 1 month. So I'm just sharing that kind of information.
Yeah, thank you very much for that. I know it is terribly expensive. Even here in the UK, it's expensive. I'm on a drug called Revlimid, and Revlimid is about £4,000 for a month. Okay, well, actually 21 days. Okay, £4,000, 21 days, and that's just one. Okay?
Yes.
If I put up the pile for you, but let me call in Jennifer. Jennifer, one of our speakers. You know, you in the beginning, you know, you because your area was on, you know, when the doctor says cancer. So tell us how do you feel now?
Now I don't even feel like someone who had cancer, to be honest. And okay. I'm just responding to Nurse Felix. I was fortunate. I didn't have too much of a violent reaction to the chemotherapy. People saw me after, and again, I didn't have a very long cycle. Maybe everybody's different. I never threw up, not once. So I think the early stages, from the very first chemotherapy treatment, I learned how to deal with it. Having been a mother, I'm not sure if that helped me with morning sickness and so on. I did the exact same thing. Got up in the morning, had crackers on an empty stomach before I actually got up. That kind of almost settled my stomach. Another thing that helped a lot was very, very cold, something very, very, very cold. So when I learned that after the first cycle of treatment, I would stock up on those things because I know I would feel weak not to go to the supermarket. That's just on the practical side. Somebody mentioned about cooking. One of the things that you can do is to have your meals prepared and frozen in the fridge. So, you know, whether it be a light soup or whatever it is, rather than having to come home after chemotherapy and thinking of having to cook and so on. But in terms of I mean, I feel good. I can't say what's happening on the inside of my body, but mentally, I feel fine. I can say I might be one of the lucky ones. I didn't have too much of a violent reaction. I did all the radiation and my skin never cracked, not once. So everybody's different. I don't know why people respond different ways to different things.
Yeah, thank you. And Alison, anything that you would like to add there?
Well, for me, until now, I still felt like maybe it was a wrong diagnosis. I don't feel like somebody who has ever had cancer. And when it came to chemotherapy, I never felt nauseous or so. They give you the medication, and as soon as I got home, I drank my medicine. So I never felt, it never upsetted me. And the only thing I felt, I was sleepy a lot. And usually I'm not a person to sleep during the day, but once I got home from chemo, I used to sleep during the day. But that's about it. It never really did anything bad to me. my experience was like, I don't know. I never really had any kind of
Yeah.
side effects from it. But now I'm experiencing side effects of the rheumatoid inhibitors that I'm taking and the dry skin. Yeah, just recently somebody sent me a cream that is created, and I've been using it and I find it is really, really working. So when I finish with my sample bottle, I will get the information from the person, and then maybe I can share the information with others. Because this dry skin is
Okay, thank you for that. Thanks for sharing that with us. Okay, I know all three of our guests and speakers have almost the same kind of condition, breast cancer. And I was just wondering, in the room, what are the different cancers do we have here? I'm multiple myeloma, which is a cancer of the plasma cells of the blood. Okay, who do we have in the room there? What kind of cancer do we have?
Hello,
Anybody want to share?
can I speak?
Yes, of course, Sandy. Is that Sandy?
Oh, yes.
Yeah, go
Well,
ahead.
okay, I have a tumor at the base of my skull on my neck area.
Okay.
Right now I'm taking chemotherapy. That's the second time around I'm taking it. Last 2 weeks ago I did a scan, and the doctor saying that it went down a bit, but there's still some swelling, so I have to continue taking the chemotherapy. And it's not sure that I will be taking some more radiation. But I've already taken radiation and chemotherapy in 2013. So it's a tumor that I have.
Okay, thank you. Thanks for sharing that with us. Okay, and we wish you all the best in your treatment. I mean, somebody did put in the group there about I think the cure to any type of cancer is a strict alkaline diet. Continue taking your meds and you will get the results in no time. And again, I just would want to stress that we're not giving medical advice here, but we're just sharing what it is that we are on and how we find it. Because I can go on for the whole night and tell you about mine. But thanks very much for that. Thanks very much, Sandy. Anybody else want to come in? Yes, Ursulin? See your hands up for Ursulin.
Hi, Solomon and everybody else. Thank you, first of all, for inviting me to that Zoom meeting. Can you guys hear me?
Yes, I can hear you. Go ahead.
Okay. Thank you guys for inviting me to that meeting. Very informative. I'm hoping that one day I'm able to share my experience, having been through it twice. 21 years ago and then 3 years ago again, same breast, everything. I hope one day I can really share my story with you guys at a later meeting.
Okay, it would be a pleasure to have you, and we want you to join the Saint Lucia Cancer Society and Pillars of Hope. Okay.
I used to be part of the Cancer Society, but that's when I was home. Now I'm no longer in Saint Lucia, so.
Well, I'm not in Saint Lucia. I'm going to pull your leg there. Okay, the world is now small. COVID makes it very small. Okay, so there's no such thing as in Saint Lucia, not in Saint Lucia. We are one. Okay, so
okay.
And is it 300 US per person? Just say yes, because she's in the States. She can pay that. Okay. Thank you very much for that. Okay, Buffer. I see you have a hands up, Buffer.
Good evening.
Good evening, Buffer.
Can you guys hear me?
Yes, I can hear you.
Okay. Thanks for inviting me, Auntie. And I'm so proud of you. And I pray for you guys' strength, everyone that is in this situation. And sorry to hear all what you guys have to go through. Okay.
Okay, thank you very much, Buffer. We are strong. We are strong, and together we're going to get there. Okay, we are here to support each other. Thank you very much for that. And
okay, you're welcome.
Agatha.
Okay.
Good evening, everyone.
Good
I'd
evening.
like to especially thank Nurse Marius for inviting me to this forum. I do not know if I have any cancer right now, but I have had about 4 persons who've been related to me who have passed with cancer in the latest stage. I've had my grandmother, my aunt, my cousin, and the last person to die with cancer was my 2 and 4 months old grandson. He died of lymphoma, and all of the cancers that when my family members went through, they were diagnosed in the last stages. So my heart goes out to all the people who suffer from cancer, one form or the other. And the health, food, and nutrition is something that is very dear to my heart. So I want to tell all of you that I will keep all of you in my prayers and be strong and always keep the fight. Thank you very much. And thank you for inviting me. God bless.
Thank you very much, Agafa. We
Thank
do
you.
appreciate it. And I'm sorry to hear, so many members of your family has passed. And I'm sure this is, many other people, many of us, in the room here would clearly understand that. Okay. What about Meredith?
Good evening.
Good evening,
I would
Meredith.
like to thank Lion Monica for inviting me to be part of this session. And I too, have a heart for seeing people recover from this, those who have gone, recovered, and those who have passed on, regrettably. I have lost my dad to cancer, brain cancer. I've lost other family members and friends. And currently my husband is in recovery of prostate cancer. So I am kind of like being given the support and living through it with him. And he's had radiation. So he has, the sweats, and sometimes he feels hot and cold, and 1 minute he's hot, one time he's cold. He goes through different situations. So we are going through the process together. So I think I can identify somewhat with what some of our speakers, our presenters spoke about tonight. I must say, I must applaud them for these presentations. They were very thorough, they were very relative, they were very educational, and there's so much more that we have learned tonight. We're all the better for it. So I want to thank you once again for inviting me, and I will also keep you survivors in prayer and those who are going through it themselves. And let's hope that we continue to bind together and keep on learning from each other, supporting each other in prayer and otherwise. I heard you also ask that those who are not diagnosed, have not been diagnosed with cancer, whether we're interested in supporting, or I don't know what the process is with, like, if you want to become a member. So I am interested because I too, part of our club, we have done, like Lion Monica, we've had a lot of these sessions over the years for persons or for men and women who are suffering all the various aspects of cancer. We've had cancer presentations and all of these. So it is something that, we are very much exposed to and love being a part of providing that kind of support. So thanks again for inviting me.
Okay, thank you very much for that, Meredith. And friends, okay, survivors, everyone, I know time is running out on us, but I'd just like to take this opportunity to invite Mrs. Donna Emanuel, who was diagnosed with breast cancer in 2016 and discovered that she was pregnant around the same time. For Donna to give us the vote of thanks.
Good evening, everyone.
Good evening.
Survivors speak, and indeed they have spoken. I'd like to take this opportunity to thank all our presenters, Jennifer, who spoke on mental health, Alison, who spoke on treatment, and Monica, who spoke on chemotherapy. Your information, that what you have shared, it's so much information, a lot, and we can get a lot from it, especially those who are going through treatment right now. So I believe this will help go a long way in assisting those who are who are having treatment right now to cope better. So I'd like to thank you very much. I'd like to thank Alexis Solomon, our moderator. Job well done, exceptional job at it. And there are also members of the Cancer Society, persons who assisted during this month of activities. This month of activities has truly been a success. I would like to thank Full Spectrum, Dr. Delia Samuel, who presented last week before,
yeah.
And Jada Emmanuel, who assisted with sip and paint, Isaiah, Dr. Tamara Remy, and all the other doctors, Jason for photography, Lucilek. And once again, I'd like to thank all of you, our presenters. And a special thank you for Francisca Plummer, who has been the driving force of this group, Pillars of Hope, giving us all the hope that we need. So I'd like to express my heartfelt gratitude to Francisca Plummer. Also, I'd like to encourage all persons here who are in attendance to take this opportunity and be part of Pillars of Hope. We need each other. Our experiences go a long way in helping each other, in as much as our doctors, oncologists would give us guidance, but we can learn so much from each other's experience. So once again, thank you, everyone.
Okay, thank you very much. We do appreciate it. Okay, and in closing, I would just like to say, I know we have had the vote of thanks, but to me it's very, very important for me to just give. I can see some names of people in the group there. I have my niece who's in the group. I would not mention her name, but she was recently diagnosed with leukemia, and she's just about to leave the island of Saint Lucia, hopefully very soon, to start her treatment overseas. So I'd like to thank her. Her sister is also there from Hawaii. Also, I have my sister there who is listening in. Okay, I have my sister-in-law. I can see, well, she's at the bottom because her name starts with V. Okay, okay. So I'd like to say, thank you guys for joining us. Also to our friends from Antigua, we have people. We have also been from Tortola, Martinique, France, Germany, the United States, various parts of the United States. I'd like to say, good evening to all of you, and thank you very much. And the final thing that I want to say is to encourage you to, especially those of you who are in Saint Lucia, okay, if you could join the Cancer Society, okay, and become part of our Pillars of Hope. We meet the second Saturday of every month. Okay, currently on Zoom. Okay, and I hope it can stay on Zoom so that I can be part of it since I'm not in Saint Lucia. And so, yeah, please do send us an email, send the group an email, and we'll make sure that you get the necessary information and you will be contacted, because it is important that we stick together, that we share. I tell people all the time, when I talk about my condition, I feel much better. Okay. And Alison mentioned something about doing research, some people say that's the good thing. Some people say, thank you very much for putting that up. Some people say it's the bad thing to go and do research. I say choose where you do your research. Don't just listen to anything. It's not everybody on YouTube that says that their doctor is a doctor. Okay, please bear that in mind. Okay, so choose what you read, okay, so that you get the best information. But I always say, start off with your doctor, start off with the person who's going to treat you. But okay, together we'll get that, we'll get there together, and we'll do this. You can see our email address online. Okay, Pillars of Hope at stluciacancersociety.org. We have our telephone number there. Okay, please drop us a line. Okay, and together we'll be there. Again, I'd like to just thank our three presenters. Okay, Monica, Alison, and also Jennifer. Thank you very much, and for organizing the whole thing. Francisca Plummer, thanks very much. I don't know if you'd like to say anything before we call it. We have 3 minutes before 1 o'clock my time.
I don't have anything to add. I think this has been exceptional. I think for me, it's thank you to Solomon for leading us so well this evening. Thank you. I always thank you, survivors. I consider myself a supporter. I'm not a survivor myself, but I am always honored and humbled to be part of this journey in any way with you. And I'm happy to be part of Pillars of Hope and to coordinate the group. I hope to see everyone at Pillars of Hope. Thank you very much for joining us this evening.
Thank you very much. Okay, if you can unmute your mic, everyone, so that we can give a round of applause to our three presenters, that would be fantastic. That's what I want to do. Thank you very